Hello, hello. All right, we're back. Try number two. I think it's going to work. I am really excited to talk with Liz from Mammogen today because, one, we've been sharing a little bit more about Mammogen here on Instagram in the feed and have had an overwhelmingly positive response to what Mammogen is up to. So I think it's going to be amazing. Liz, you're texting me. Okay, you're updated. I just joined the live again, Liz, so hopefully you'll be here. I see your team. I'm super excited to have you come on. I think it's going to work.
Hey!
Oh, how are you?
Gotta love those updates.
Yep. How are you feeling?
Much better. Thank you. I feel like a human being again.
Oh, good. Yeah, it's been going around.
Yeah. Yep. 'Tis the season.
Yeah, totally. Well, I don't know if you saw last week, I'm sure you did, that we shared a little bit about Mammogen on our Instagram feed and had like one of our highest engaged posts ever. Like, yeah, so I was like, oh, the timing for this live is so good because I think we've been kind of teasing out, and we've done lives before, but I think Brilliantly's audience has probably doubled since the last time we did one of these.
Oh,
So
wow.
there's like a whole new crop of people to share the good word with. So I would love to
Good.
um, and share just a little bit more about Mammogen and about who you are, Liz.
Sure. Mammogen is special. I think Brilliantly is probably one of the only other companies that I've come across that shares so many of the same values. And it really sets us apart. Mammogen isn't by scientifically, we're about early detection of breast cancer disease right now. We will grow Mammogen into a leader and a force in all things women's health, but we're starting in an area that's personal to us, in an area that is woefully underserved right now. And for a population of women who I think deserve to start having conversations about the hard things. And so while in the lab, we're focusing on detecting stage 1, stage 0, even, in fact, breast cancer from blood and saliva, our mission is so much greater than that. We want to start to close the gap between science and community. Science is just one little piece. Giving somebody a diagnosis of early stage breast cancer is the beginning of a cascade of things that changes their lives forever, that changes them forever, that changes the lives of those they love, the people around them. It changes what becomes important, what they need, the support, everything. And I think that that's often ignored in diagnostics. And so Mammogen is here to close that gap, to start talking about the impact of the disease, of the mental toll it takes, of the conversations that need to be had, and really what that means. What does it mean when we offer somebody a solution to detect their breast cancer early? It doesn't just mean we improve their outcomes. It could mean that we're talking about a lumpectomy versus a mastectomy. It could mean that we're talking about treatment that doesn't have to include chemo and radiation. It means that we're giving people time to sit and talk with a reproductive endocrinologist and think about their family planning and all of these kind of intangibles. Those are important to me and to our team and to Mammogen. And we want to figure out a way to weave science into all of those solutions.
That's so awesome. I think you're totally right. There's a huge, huge gap. And there are some cool tools being developed and cool companies doing stuff. But unless you have an amazing doctor, someone who's like having that conversation with you about things, and sometimes depending on your mental state and what the news is, you might not hear it anyway.
Yeah.
But totally right that this is like, it's like it's a almost blank space, or that's like maybe depending on where you are and who you are and who your community and network is already, but
Yeah.
millions and millions of women. And before we dive in, Liz, who are you?
I am, first and foremost, I'm a mom and a wife. I have a wonderful husband who His name is Tommy. He's really the only reason I can do what I do. And Kristen, you and I talk about this quite a bit. It's nearly impossible to be an entrepreneur and a mom and a wife and a woman and a person and a sister and a daughter and, you know, not lose your marbles. And Tommy has really been my immense support system. He's a stay-at-home dad, and he picks up all the slack that I inevitably leave behind as I'm trying to create solutions that don't exist today. And then I'm a mom. I've got two wonderful kids. Thomas is 9. He's my little sweet-hearted hockey player. And Violet is she's 6. She is a complete savage in all the best ways. She's my little gymnast. She will take on this world and do something like we've never seen. And so I have 2 so wildly different but amazing kids. And that's why I do what I do. Girl, we got some work to do. We cannot leave the world like this for our sweet babies. And so, you know, it keeps me focused and driven.
Yeah, awesome. I love that. I think, you know, every once in a while when I'm talking to another founder on here, we dip into talking about like what it actually means to run a business or to fundraise or the bias or being in women's health and all of the obstacles. And this is, you know, not just me and you. This is like literally every person trying to change the face of women's health right now. And there are lots and lots who are pioneering that effort. And I think really early on, the bias about being a mom was so real. You know, I would have men, I was going to say people, but I'm just going to throw it out there and say men, ask how old my kids were and then make an assumption and say, oh, good, then you're not going to have more. Or, oh, good, you've already had them.
Yeah.
Or, you know, and then the flip side of that being like, well, how do you manage? What's your support system? What happens if one of your kids gets sick? And I think being a mom is actually a superpower.
It is.
Learn so much, not only about yourself and your body and mortality, but you also learn to figure out what's the most important thing, what needs your attention. You can triage, like I'll run the world, you know, and a lot of those skills come from being a mom.
Yeah.
I think it makes us really successful and motivated business people, especially if your business is something that you know is going to change what the lived experience is going to be for your kids. And of course, what you're doing is going to help your daughter and my daughter too.
Mm-hmm. Yeah, absolutely. I'm telling you, if mothers can pick up cars to save their children, starting a successful business is a piece of cake.
Yeah. I think about that sometimes, that like, if called upon,
Mm-hmm.
I could do literally anything for my children.
Yep.
And like, what an amazing thing about myself that I didn't used to know.
Yeah. Yeah. No, you're right. It's funny. I tell Thomas and Violet all the time that being a mom is a real life superpower. That there's nothing else in the whole world that is as strong or as powerful as being a mom, or loving like a mom, or executing like a mom. You can't beat it.
No, totally. Well, you know, I posted, and for those of you watching now and later, I want you to know Liz is like one of my favorite, most amazing people on the planet, and also so generously had Mammogen sponsor a giveaway with 50 women in the breast cancer community last winter. We gave away 50 sets of Brilliantly Warms and conducted a study with those women, a self-reported study at 1 month, 3 months, and 6 months. And we just finished analyzing the data from that. And in our post last week, part of what we were asking wasn't just questions about using the product that we here at Brilliantly designed, but also tried to ask questions about quality of life issues, about things people were experiencing, about moments around diagnosis, so we could really help move the needle for both of our businesses to meet the needs of women in this community even better than we could just trying to brainstorm things on our own. And the questions that we asked about Mammogen's technology, without saying, hey, Mammogen's developing this technology, but what would it mean if, for your physical stress, for your mental stress, for the burden? And we posted about that last week. And it was really amazing to see the feedback and how many people said, if I had had the opportunity to have some kind of liquid biopsy for my diagnostic, that it would have been absolutely game-changing. And I think there's a barrier there to understand what that is, Liz. And I think like now post-COVID, we all understand about like what is different types of biopsies. I think we used to think of a biopsy as like a needle biopsy.
Mm-hmm. Yeah.
all know that there's all different ways that we can diagnose things. So it would be great, I think, from an educational perspective, if you could talk a little bit about what is a liquid biopsy? How does that work? What does it mean if you're someone in the future who can ask for this kind of test?
Yeah, that's a great question. So traditionally, when we hear biopsy, you're right, Kristen, right? We think about going in, sticking a needle somewhere into some type of solid tissue formation and pulling out a piece and then sending it to pathology to say, okay, what the heck is growing inside of that, right? But liquid biopsy is opening so many more doors for us because one, you can't always go back and get tissue, right? You can't always just drill into somebody's brain or somebody's lung and get more sample when you need more information. So liquid biopsy simply means that we are looking at genetic pieces of information that are floating around in our biofluids. Biofluids are any of the liquid pieces of ourselves. So it could be saliva, it could be urine, it could be blood, it could be cerebral spinal fluid. Anything that you could pour into a glass is likely a biofluid. And there's a ton of information in there. So at Mammogen, what we're doing is looking at RNA markers, which I suppose if there's a silver lining to COVID, everybody now at least has heard of messenger RNA, right? It's a complement to DNA, but messenger RNA is special because it's like if you could listen in to what your cells are doing and all of their plans, good, bad, and ugly, you'd be listening into the messenger RNA talking to itself. And that's what we're doing. We've found 26 of these little chatterbugs that are very important, especially in early detection breast cancer. And we found out how to put them together to listen to what's happening when cancer first takes root. And so what that means is from blood or from saliva, we can hone in on these 26 messenger RNA biomarkers, and we can detect and diagnose the disease at its earliest stages. And truthfully, it's really not any more complicated than that. The hard part is finding the right markers and listening to them at the right time. And once we figured that piece out, turning it into the actual test, that's less difficult. The hard part is behind us. And now it's just about turning it into an actual product that we can get into the hands of all of the women who really deserve a solution for early detection.
That's awesome. Like, I honestly can't wait. I was just at that health conference. I think about inequity in healthcare all the time, about insurance, about, the system here is so broken.
Yeah.
The idea that someone could very simply take a test like that and understand what was happening in their body is game changing. I mean, even if you just think about the time, like if you're someone who is working and taking the time off and sitting in the waiting room, like there's all of these obstacles that are like simple everyday things that prevent people from getting the best information at the earliest moment. And a lot of it is about fear, about the financial cost, about and like this has happened to so many women I know, even if they haven't had a cancer diagnosis, where they're like, something looks weird, something feels weird, they go to their OBGYN. Their OBGYN is like, oh yeah, definitely, I feel that too.
Yep.
Probably going to be nothing, but let's go through. You have a mammogram is like, oh, you have dense breast tissue, so you probably need to have an ultrasound. And then you have an ultrasound. Oh, I'm not sure. Let's also do an MRI.
Mm-hmm.
That's thousands of dollars.
Yeah.
That's weeks and weeks, if not months of your life, time off of work. It's childcare. It's all of those things. And I think the technology that you guys are developing at Mammogen is going to make it so much easier for women. And then also that it's earlier, that you can find it earlier is like, it feels like a miracle.
It in some ways it does. And I want to take a minute and just think about what you just said there, because a big part of the reason why I'm here at Mammogen is because I was one of those women. I was 3 years ago, I was 38 years old. I had 2 little kids at home, found a lump in my breast, and I was like, shit, man, how could this possibly be? I'm young, I'm healthy, I'm in shape, this can't be me. Went to my OB. She said, oh yeah, I feel that, and it feels solid. Let's go for a mammogram. I, like most other women, have dense breasts. So on I went to the ultrasound, inconclusive. On I went to the MRI, on I went to the biopsy. And that time, that was 16 weeks From the day I called my OBGYN to the day I got, thankfully and very gratefully, clean biopsy results. 16 weeks. Now, what would have happened if it wasn't a negative biopsy? Especially as a young woman under 40 at that point, we know that cancer progresses much quicker in the younger population. And oftentimes it's more aggressive and it's most likely to recur. So why am I waiting 16 weeks for information, right? It's inherently wrong. But then I've also robbed somebody of 16 weeks of decision-making time.
Yeah.
Right. I've spent, and Kristen, you and I talk about this all the time. Continue to spend a lot of time talking to women in their breast cancer journeys, all different phases. Because I just think, how could I possibly serve them if I don't understand the complexities of their journeys and their stories? But one of the things, the one like totally intertwined piece of information that everybody agrees on, especially the young women, is I wish I had more time from the time I knew I had breast cancer to the time I started treatment. Yeah. I wasn't done having kids, but I didn't have time to talk to a reproductive endocrinologist. Or some of them, and this is just heartbreaking, I hadn't even thought about family planning yet, and I didn't have time to freeze my eggs. And now it's the first thing I have to talk about with somebody when I get into a relationship. And all of these things are just avoidable and preventable with liquid biopsy. And those things are almost just as important to me as telling somebody, yes, you have cancer and it's stage 1 and we did it from a blood draw, right? That's all clinically and scientifically really important, but emotionally, it changes the game. It changes every single step after that. And that's really what we're trying to accomplish.
Yeah, I think that's so important. And I think the medical community, rightfully so, spent many decades thinking about how do we keep women alive?
Mm-hmm.
What does it mean to be alive
right.
after surgery, after you've taken action?
Yeah.
And we support people on that journey that now is decades.
Mm-hmm. Oh, yeah.
Lots of people have a long life after they have a cancer diagnosis. Mm-hmm. But I talked to a guy yesterday, like totally unrelated to breast cancer, but he had a brain tumor as a teenager. Talking about all of the things, and now he's the same age we are. He's 40, and he has spent decades living, and it was a death sentence then. And he, talked about the miracle of his survival. But you can feel like complete joy that you are still alive, and struggle every day with that you won't have children, or you won't be able to breastfeed those children, or have to have that conversation with every new sex partner, like, hey, guess what?
Right.
This is different than you might think. And how stressful that is for people. So I think everything that you're doing is so amazing. And I love that you're thinking about it from such a holistic perspective, especially coming from the science angle, that you and your team are also committed to this much bigger and very important vision is so cool. So for people who are watching now, what's the timeline? How do we get involved? Because I want, before we jump out, yes, totally, we need to think about the human in the room. I want to talk about the Mammogen marketplace, because I think for right now, that's the way that people can spread the word and be empowered to walk around and say this is what this means, this is what this is, this is what this is. But let's talk a little bit about the Mammogen marketplace, and then the timing of when we can expect to be able to step into our doctor's office and ask for this test.
Right. Mammogen marketplace is something that's entirely unique to the diagnostics market. And it was born out of one very important thing I want to change in diagnostics. I think it is ethically, morally, and just humanly wrong that the last time a diagnostics company interacts with a patient is when we send them a bill. Until that changes, nothing much more will be able to be improved upon. We have to stop thinking about collecting revenue as the last touch point we have with our patients. And Mammogen Marketplace is just the first step in what I hope will be a haven of resources where Mammogen can continue to talk to and interact with and touch and feel and impact all of the wonderful women and men and loved ones that are part of our ecosystem. We are starting by marketing all types of Mammogen logo gear. I'm proudly wearing my camo hoodie, which I have to say is super soft on the inside. I love it. And that's really to do two very important things. One, to give people a way to interact with us right now, to help us spread the word about Mammogen and what we're trying to accomplish. But two, to bring in funds that we can then redeploy. Every cent that comes into Mammogen Marketplace goes to one of two places, either directly into R&D to make sure this test gets into the hands of women as quickly, efficiently, and safely as possible, or two, to continue to fund wonderful community endeavors like what we did with Brilliantly. I want to take what you and I did, Kristen, and transform that into a million different companies and women and female founders and patient bases that need information, that need resources, that need tools. And I want Mammogen to be able to participate and help fund all of these things that are just as important as making the test. And so that's what Mammogen is all about. Mammogen Marketplace is all about right now. We are fiercely working to be able to add resources and new products with a focus on other female-founded companies, other women's health-driven alternative solutions. And so my dream is maybe a couple of years from now, you and I will be sitting here doing another IG Live, and Mammogen Marketplace will be the place for all things women's health.
Well, I love that so much, and thank you on behalf of Brilliantly, but also all of the other founders that you're going to support. I think so many of us, as I started out saying, are working in a space where there's missing data, and we have our own data, and creating your own data is expensive and it's time consuming, and not a lot of people want to fund that early stage research. And I think that you're totally right that the founders who are making products that are alternative, that are patient driven, that are informed by user experience and by actual conversations with women and not necessarily the bottom line, those support desperately, because they really do change lives. So thank you for that. And I'm just excited for people to be able to walk into their doctor's office and ask for this test as an alternative, and hopefully we'll see that happening soon.
Yes, we are targeting to have this in the hands of all of our patients as early in 2024 as our clinical trials allow.
Well, I can't wait. And in the meantime, do you guys have a mailing list? Is it best to follow you on social? Like, what is the best way for people to stay involved and follow along?
Yes, absolutely. So follow us on social, follow us on LinkedIn. I am admittedly a total newbie when it comes to Instagram. Kristen and my team are helping me learn how this all works. So I'm doing my best, but I still have a long way to go. But please follow me on Instagram. Reach out to me through our website. I do get back to each and every email that comes into Mammogen's website, which is mammogen.bio. Follow our story there. Follow our parent company, which is IVBH. That is really where much of the scientific and platform knowledge and magic happens, and we deploy that down into Mammogen and our sister companies. And you'll start to see some really bold messaging coming out of IV Bio Holdings and Mammogen, and that is by design. So buckle up, ladies, because nothing coming out of here is going to feel or sound like anything else you see anywhere in the diagnostic industry. And I'm excited about that. Until more people start actually talking the truth, nothing's going to change. It's going to be status quo forever, and I refuse to let that happen.
Well, I'm so happy that the world has you, Liz. And thank you to Marty, who I see on here, and Catherine from your team. I am like every day amazed at what you guys are doing and can't wait to watch you change the world. And thanks for being a part of the Brilliantly story and for your time today. And Liz and I are about to jump on another call about a really big project that we will be about very soon. So I hope you have an amazing Tuesday. Reach out if you have questions about Mammogen. Liz really does get back to everyone. And if you have a question for me, of course, reach out to me too. I love chatting with people. So thanks for the time and have a good day.
Thank you, Kristen. We love you.
All right. Take
All
it.
right. Bye.